Shelby, I can't believe I'm having you on the podcast. I'm so excited. Thank you for being
Thank
here
you.
today.
No, thanks for having me.
There is so many people that ask about what it's like to work in perio, and I've worked a little bit in perio, temped a little bit in a periodontal office, and I worked with a periodontist. But I know you full on are working in a perio office, so I'm just excited to share with the audience like what it's like being a full-time dental hygienist in a perio practice. We won't get into all the like bacteria and all that stuff, but just kind of more of like what the experience is like. This isn't going to be like a continuing education course, but I'm interested to hear how you fell into working in a perio practice.
I think, like many of us dental hygienists, we get out of dental hygiene school, we're eager, we're excited, we go full throttle into hygiene. And I think that first year is really high burnout. I was working in a practice, a very high producing practice. We did everything across the board, and there was bonus incentives, and it was a lot of recommending, and it was go, go, go. I got really burnt out really fast. And my background is working in oral surgery. I was an oral surgery assistant for 9 years. And when I had moved states, I saw that there was this advertisement for half surgical assisting, half dental hygiene, but you would still get paid as a dental hygienist. And I thought, wow, this is a great opportunity. I can use my surgical skills that I developed. I can still do hygiene, but it kind of will be a little bit tapered back on the hygiene world. And the timeline of that position just didn't really work out for when I was moving. But the employer ended up reaching back out to me like 3, 4 months later saying, hey, are you still interested in working in the perio practice? However, it wouldn't be half surgical assisting, it would be full dental hygiene. And I was kind of in the middle of temping, just trying to find my permanent office. I was even applying and interviewing with Invisalign, but that required a lot of traveling. And I was like, you know what? Let's just give it another try, see if it's for me. And I found that working in perio, if you are someone who likes a challenge, you are driven, you're eager to learn, it's a really great place to be. I kind of landed in this periodontics role as a dental hygienist. And now that I'm in it, I honestly don't think I could see myself going back to general.
How long have you been in that position?
I've been a full-time periodontics dental hygienist for 2 years now. I am unfortunately working Monday through Fridays. I am working close to 40 hours a week, and it is a back-breaking position. I mean, all of us dental hygienists, whether you're in peds, ortho, general, perio, it is all difficult in each way and, each unique way. Perio is backbreaking. Eventually, I would love to go down to 4 days a week, but I am in school right now, so I am paying for that. Hopefully, maybe another year and I can go down to 4 days.
What are some of the differences between maybe like comparing it to working in a general practice? I think that's what a lot of hygienists kind of wonder because a lot of us get into general and then we know that there are perio offices out there, but we haven't really been in them. What are kind of like the initial differences that you realized?
When you're working in general, you kind of have your hands in all kinds of pots depending on the office. You are really focused in on restorative. When you take bite wings, personally for me, when I was working in general, the first thing I was looking at were those interproximal surfaces. We're talking about Invisalign, we're talking about fluoride, we're talking about whitening or cosmetic work. In perio, we're not talking about anything but the gums. Everything is full throttle on the gums. A lot of people do ask me, well, what is the difference in a cleaning at a periodontal office? What's the difference that a dental hygienist at a general practice couldn't do? I would say it should be the same. When we are seeing these patients for periodontal maintenance, we are doing localized SRP almost at every single visit. There is local anesthetic involved in almost every single appointment. We are managing implants, I would say, a lot more so than personally what I was doing in a general practice. Things are a lot more involved, but at the same time, patients are motivated because maybe they've already been experiencing tooth loss and they realize, oh my gosh, I need to change my habits now or else I'm going to continue on in this path. There's a lot more pain management. A lot of our patients have sensitivity. A lot of our patients have 7, 8 millimeter pockets to begin with. A lot of patients I'm scaling in 10, 11, 12 millimeter pockets. So, pain management, we're focused on the gums, focused on a lot of patient education. And again, not that anyone in general is not focusing on, but we don't have to think about any of those other needs for the patient. We can just do our thing, keep the gums healthy.
What's your patient schedule like as far as like how many patients and then what kind of procedures are you seeing? Like mostly perio maintenances with SRPs here and there? What does that look like for you?
Typically, we would never see more than 2 SRPs in a day. So I personally like my SRPs right before lunch, and I like it at the end of the day. That way, if they are more involved, it can go into my lunch rather than running behind. I'll just stay a little bit later after work. I just want to make sure every patient is getting the best care possible. Typically, a day looks like either 1 or 2 SRPs, and then there's periodontal maintenances mixed in, of course. As the dental hygienist, we're also seeing a lot of the connective tissue graft reevaluations. We are also seeing a lot of what we call prosthetic checks when patients get their crown on a dental implant. Our office, we like to look at that crown to make sure it is screwed in right. If it's cement retained, make sure there's no residual cement. We like to go over a lot of patient education about implants with the patients. I do think a lot of people get these implants and then they just kind of take care of them like they would any normal tooth, which is great. However, implants are a lot more susceptible to gum disease. Our practice likes the patients to be seen with the dental hygienist after they get their implant crown. We can go over further patient education on how to take care of that crown. We're seeing a lot of the doctor's appointments, post ops, connective tissue graft, evals, implant, post ops.
A lot of the time I see implants and it's almost like, they've had them for years and nobody ever taught them how to clean them. I love the idea of doing that because the oral hygiene instructions for implants definitely gets kind of lost in translation sometimes.
The senior doctor that I work for, he was one of the first in my area to start placing implants back in the early 80s. And he found that he would place these implants. And back then it was still a very new procedure. He didn't even know about, the long-term effects of implants. These patients would go see their general dentist every 6 months for cleanings. They'd come back 5, 10 years later, and there's very severe peri-implantitis. He decided after he places these implants and after they go back to their general dentist, get these crowns done, he liked to double check the crowns, make sure they're fitting perfect because he found a lot of peri-implantitis happen because they weren't screwed in right. There was extra cement. There was no education being had. He really likes when us dental hygienists sit down with the patient, hand them a mirror, and go over how to take care of those implants. So I feel very fortunate. I work in a very high priority oral hygiene instruction and education office.
Which is what we do. So that's
Yeah.
incredible. And I mean, that's such an investment into the implant in itself. Every patient that gets an implant should have the opportunity to have those instructions given to them in that type of way instead of finding out years later when your implant is failing. I wanted to go back to what you mentioned about SRPs and how you do 2 per day. A lot of the times the SRPs that are being referred to perio can be, I would say, more complex cases than what we see in general practices. But I still think it's good to give some perspective of why you only do a maximum of 2 SRPs per day. And not just in perio, but maybe even more so too for general as well.
Yes, in perio, we are seeing very complex cases. We are seeing the cases that maybe the general office didn't feel accomplishing themselves. They just knew it was too involved. That's our limitation. We would never do more than 2 in a day. We do get 2 hours with each patient, which is great. But whether you're scaling 5, 6 millimeter pockets, whether you're scaling 7, 8, 9, maybe 12, millimeter pockets. It's exhausting. And even if you were to do 2 SRPs in a row, personally for me, I cannot give the best care to my patients because I'm exhausted from the appointment prior. I hope not many people are doing more than 2 SRPs in a day. I know it can happen depending on, what the schedule is like, but in order to give your effort, your energy, your time, give the energy towards patient education, personally for me, there's no more than max of 2 in a day.
And to give yourself a break. I mean, I think we've been practicing around this same ish amount of time, almost to 5 years, and I feel it in my hands when I have to do an SRP. And it's like, I need a break. I cannot see SRPs all day long, or like you said, back to back. There needs to be something to break it up because it's so much harder than people realize to scale these like tenacious pieces of calculus. And yeah,
Yeah.
I don't know how you have felt with pain. I'm sure you've had some areas that have been problematic.
Neck pain is real, even with the best posture, even with taking care of yourself, keeping yourself hydrated. We are in these prolonged static positions all day long. Even if you did everything perfectly as a provider, taking care of yourself, unfortunately, chronic neck, back, wrist, finger pain is something that I think is completely unavoidable. Especially after, let's just say you did 2 SRPs in a day, you can feel it even in the vibrations of your ultrasonic, piezo, whatever you're using. I can feel it after the second SRP of just almost 2 hours straight of using that ultrasonic. It leaves my hands really sore.
Yeah, I can literally remember this one patient, this SRP that I did that was just so hard. I have this like almost like a mini, it's like a ganglion cyst starting in
Yeah.
my hand. Yeah, yeah.
Oh, okay.
And after I was done with that SRP, it was like on fire. And it was like
You're
that
like
for like a couple days.
you're like, "I'm gonna schedule the second half with the other hygienist."
Yeah, I see him for his perio maintenances. I'm like, I remember you. My hand remembers you. Like, but I mean, it's awesome to hear that you have like a different types of appointments in your schedule. I don't think every periodontal office is like that with like the evals and the crown oral hygiene instructions and things like that. But I think it's such a good way to break it up. And if you are a hygienist working in perio too, I think it's important to really understand production because your production is going to be a lot different than somebody who is working in general practice. At your practice, is that something that you guys look at or talk about or anything like that?
We are an out-of-network office, and all of the periodontic offices in my area are also out of network. There is a luxury to that in which the doctors can set their fees to what they feel is needed to pay their staff well, pay for all the overhead, allow us the right amount of time with the patients. So at my office, in a sense, I'm grateful that it's not being kind of like pushed down my throat. I do understand the importance of production and how it comes back to us as employees because if we're not producing, then that limits our benefits, that limits our pay, that limits a lot. My doctors set their fees for what they think they need to run the practice efficiently with quality staff, quality care. So there's really not too much talk of production, but I think when you diagnose properly, and I think when you do things by the standard of care, production just kind of comes.
It seems definitely like it's a to being a hygienist in a periodontal office as far as like production goes. What are some other pros that you found working in perio?
It's the mentorship of being with these periodontists who are passionate about periodontal disease. You're learning from them. You're using your skills in ways that you never thought you could. If I was not a strong scaler in school, I went during COVID. We weren't allowed to use our ultrasonic. And If you would have told me or showed me like the things that I can do now, I would have never believed you because I was not a strong instrumentation person in school. I think the mentorship from the periodontists, the skills, I think the fact that patients are motivated, they've had experience with tooth loss, they understand that they really have to kick up their oral hygiene regimen. That makes it a lot easier too.
I know we've talked about this before too. Just, seeing periodontal patients, sometimes their systemic conditions can also be more complex, maybe, than some of the patients that we see in general practice. And I do feel like when I'm seeing a really like perio involved patient, you're really thinking like deeply into that patient's systemic health. And how does that affect you on a daily basis? Because I know we're seeing some really sick patients in perio and having to witness that inflammation and that bleeding and that tooth loss. How does that take an effect on you emotionally?
It's hard, and actually that's one of my cons about perio is I'm a huge advocate for educating people in their oral systemic health. I'm, a part-time fitness instructor. I really care about full body health. And one thing about working in perio is you are working with an older population. And I wish I was seeing them 20 years ago before they had periodontal disease or some of their other systemic conditions, and I could have educated them about the importance of taking care of their mouth so that they're taking care of other parts of their body. Because now you're kind of educating in a point where, well, yeah, these two things are related, but you're not educating to prevent the diseases they already have. But I really do my best promoting oral systemic health with my patients. Many of them, or all of them, honestly, have high blood pressure, diabetes, Alzheimer's, dementia. I had a patient today who has erectile dysfunction. I mean, these are the topics I try to have with my patients, and some of them are glad that I'm educating them. Some of them I still think they don't believe that there's a
Yeah.
connection.
we
But
we all have those ones. It's kind of a pro and a con because of course, like you said, it's pretty taxing and you wish you could have been the one to teach them that before the disease got to what it is. But also with my experience with perio, it gives you that eye opener of like how much it really is connected. And that is kind of really irreplaceable because once you see how serious it is and you end up seeing, like you said, almost every patient has high blood pressure and they have gum disease, you're literally seeing that connection with your own eyes. And that's really valuable. And I think yes, it gets tiring, but also what about the patients that you change their life? I mean, I've seen your videos and you educate patients so well. You're making such a huge difference. And I know that those wins feel really, really good.
we're in it because we love it, and we those little wins, those little differences that we can make in one person's life, it gives you this like high, this like little jolt of energy. Like, this is why I did it. This is why I became a dental hygienist. This is why I continue to be a dental hygienist.
I worked with a periodontist. He was like in office. He would come in once a week. And it was one of the best experiences I could have had as a new grad. I think I had maybe 2 years of experience. And he would literally walk me through the cases. Anything that I thought might need a referral, it was very easy to do because he was in office. They could schedule consult and then he would walk me through, like, okay, this is a great referral. No, I can't really do anything with this, or this is what this needs. And then when he would do osseous surgeries or grafts, he would come and get me and have me look at, the flap or even seeing the patients after osseous surgery is so eye opening. Like, I remember this one specific patient had 8, 9 millimeter pockets and then had osseous surgery. And I'm not kidding, it was like a 4 or a 3. And I
Yeah,
was like, whoa, as a new grad, it's mind blowing because you don't always get that hands on experience to see the difference that it makes. I really love if hygienists are able to somehow get some shadowing or get in a perio office for a little bit just to see the differences because then you realize how important it is to refer when necessary, and you get to see the results of that.
My background is working in oral surgery. The mindset is a little different. They're very quick to extract a full mouth of teeth, but now working in perio, I kind of see it from a different light. I see potential. I see kind of a challenge I want to overcome. I see behavioral changes that can make a big difference. I see, you're right, osteosurgery that makes the world of a difference. And it's pretty incredible some of the smallest, finest details that my doctors notice that I would never have caught. Their eyes are just so tuned towards the littlest things that if we address it proactively, we can really save these patients.
Going back to referring, I know that this is a very mixed conversation, and every clinician, doctor is going to say something different, but people are going to ask, when are we supposed to, as hygienists, supposed to be, recommending a referral to perio?
I talked with my doctors about this, and I think they believe that in a general practice, one, it depends on the doctor and how perio focused they are. Some general practices may not be very perio focused. Some general practices, those doctors are incredible at diagnosing perio, and they know how to take care of, these deep areas. So I think one, it just depends on the practice, on the doctor, on the hygienist, their capabilities, what they think that they can manage, what they think they can't. But I would say at the very least, once we start getting into these 7 millimeter, 8 millimeter pockets, I would say 7 millimeter pockets, I think it's at least best to send your patients just to a periodontist for an evaluation, see if there's anything else that needs to be done. Because I could even imagine a lot of general dentists may not pick up on some of the things that my periodontists pick up on. Even if these general dentists are looking at the radiographs, they're seeing these bone levels, and to them it looks okay. Someone with an even more eagle eye may see something different, and we can do something proactively. My best bet is it's always better to refer too early than too late.
That's such a good point. And I mean, for anybody listening too, because there's so many new hygienists here, like if you get into a practice, and I witnessed it myself, like I had interviews where I asked, oh, when do you refer to perio? And they would straight up say, we don't. And you might find that out there, but that might just be a call for you, like as a hygienist, to either try to implement some type of referral process to perio, or that might not be the office for you. But it's definitely something that every general office should at least have someone to refer to for those complex cases. I don't think that there should be any really general office out there that doesn't have a type of referral for perio, because there's perio everywhere. They've got to have some type of referral to perio.
What I used in a general practice was basically we would do SRP, see them for re-eval. We would monitor them for a year. If things got better, great, we'll keep them. But if things aren't getting better, the oral hygiene isn't great, still getting bleeding, well, we would continue to do oral education, do our best. But if we're just noticing nothing is getting better, then we would typically refer by, a year after seeing them every 3 months. So I think that's a good generalized protocol. But again, I think it's better to refer earlier than too late.
And I always just have the conversation with them. It doesn't, I think sometimes we get stuck on if you give them the referral and then they don't go. But sometimes it takes more than one time of having that conversation to get them to go. So I always like to have that initial conversation with them of like, hey, this isn't looking so great. Eventually, you're probably going to have a referral to perio. I'm almost like prepping them when I think things are not improving, and then when it gets to that point, I'm like, here, you remember when we talked about that referral to perio? Well, here it is. And I always let them know it's usually just a consultation your first appointment. You're not going to be like signing any forms to get stuff done. Just get in there and have the consultation to see what they have to say, and then we'll go from there. So I'm kind of like trying to take baby steps with patients, and then eventually like they end up going, and then they might get treatment and so on. So I think it kind of just, sometimes it's not going to be that a first appointment that they go right away, but it might take a couple times.
Exactly. It's just about planting the seed, educating them what you see, and they're obviously along for the journeys. You start seeing changes, you've already planted that seed. You start noticing A, B, and C, and when you really decide this needs to happen, they already have that in the back of their head. It's not like they're just being, like, caught off guard, like, "No one ever told
Yeah,
me
they're not
this.
going to
What
be
do you mean?"
surprised. Yeah.
Yeah.
Is there any services that you don't have that you wish you did?
Oh, a plethora.
Oh
I
yeah.
have a whole wi
Let's
I have a
let's let's go over like your top, like, I don't know, 3.
Okay, so the airflow, I think, would be really nice for my fixed implant bridge cases. I'm not sure how many fixed implant bridge cases you see in your practice. We see a lot of them. Depending on how the dental lab makes these fixed implant bridges, some of them are very accessible to clean, some of them are not. I do think an airflow would be extremely beneficial in a lot of these cases where it's very difficult for me to get my instruments underneath these implant bridges. And I mean not just like 2 implants with a Pontic in the middle. I mean the full,
The
they have
whole
no upper
thing.
teeth, like
Yeah.
they've got 6
Yeah.
implants on the top with a full spanning kinda denture thing.
Mhm. I've
The
actually seen I've seen a patient all on fours, and like I disclosed the whole thing, and it was just covered, and I was even surprised to see it. Like when I was doing it, I was like, I don't even know if this is really going to like stick or anything like that. No, it was all over the like denture part. Not, I mean, it was around the implants too, but it was all over the attached denture. And it was the blue, because I used the triplaque one. It was the acidic blue coloring all over it. And I was just really, really surprised by that. It was super nice to have the airflow to take all of that off.
I always tell patients implants are great. They do what they need to do, but they're not perfect. These implant bridges are great to get you your function, but they are even more maintenance. They are dirty, and sometimes I wish we did kind of unscrew them completely off the implants every visit to
Wow,
clean,
that would
because
be
I've heard a lot
awesome.
of hygienists or a lot of practices will do that, but my doctors, they just think for every time you torque those implant screws, every 2 times, they have to be replaced. That's an added cost. We live in, not we live in a very average income, maybe a little bit below average income region. Our patients don't have the extra money to buy screws every 2 cleanings, and that adds another hour of appointment time to allow the doctor to unscrew it, screw it back on, but that would be a nice service to offer.
Okay, what's number 2?
Probably the CO2 laser. I would really love to incorporate that into my practice. So you're still supposed to use your ultrasonic, your hand scaler, but from my understanding, the CO2 laser goes in afterwards and kind of disinfects all the pockets just to really
So like
reduce the
doing like
bacterial load.
LBR. Yeah.
Yeah,
Yeah.
exactly. I guess I kind of thought about it. If I were to choose like the airflow over the laser, I would choose the airflow, but I do think the laser could be a great adjunct
I
service.
mean, those together, you know?
Man, there's gonna be no bacteria in that mouth.
What's your third one, would you say?
I think saliva testing.
Yeah, saliva testing is really awesome. I don't use it at my current practice, but I did at a different one. And it's such an eye opener for you as a clinician. and also for the patient, it's such a good addition to oral hygiene instructions. Depending on, there's different ones out there, but it just, the one that we had, it had all the systemic conditions on there. And then depending
Yeah.
on the type of bacteria, it would have them like linked. And then you'd be able to see like the levels of how much of this bacteria you have and like the type of it and how much you have of it. And then what disease you're like more at risk for getting, which was just like mind blowing.
Mind
I love
blowing.
it.
Yeah.
Yeah.
Another hygienist has a microscope in his practice,
Yes.
so he will, like, grab the bacteria, put it on a slide, put it up for the patient. I
Hmm.
think that would be such an incredible visual because people, they hear us talk about bacteria, but it just blows over their head, but, like, to actually see the little bacteria
Yes.
moving around, I think
Yeah.
that would really put into perspective what we're talking about.
I wanna see that, like, just for me.
I
Like,
know.
I've gone to I just wanna look at all the different, like, spirochetes. There's a hygienist that posts the videos that she takes on them. I can't remember her name right now, and I just love watching them, like, move
Yeah.
around. It's so interesting. Like, you'll see it, like, start, like, eating stuff, and you're just like, "Whoa,
Mhm.
that's in your mouth."
One hygienist put the, probiotic drops over a swab of his plaque on the microscope, and you could see the probiotics working around the
Going to work.
bacteria. Yes,
Oh
it was
my gosh,
so
it's
cool.
so
So then I was like,
cool.
"Oh, that's another thing that I'm just glad I saw."
Yeah, I've like gotten to the point where I'm like being in research and like looking into microscopes would actually be so cool.
Yeah.
And like
Yeah.
I want to do that. I've also seen the like camera that you can like go subgingivally and like see the calculus, which I think is so awesome too.
Perioscope.
Yeah, the perioscope. Yeah. I haven't gotten
Yeah.
to use it, but I think that that would be really interesting to see. Thank you so much for sharing all of your information. You should also let everybody know like where to find your channels and everything because you share such good information online about perio. And so, yeah, tell them where to find you.
Where I am posting the most is probably TikTok. It's Shelby period RDH.
I'll put everything in the show notes too, so they'll be able to
Thank
find you.
you.
Well, thank you
That's so
so much
sweet.
for taking the time after your long day of work. I hope you get to relax for the rest of the night, and it was so good chatting with you.
Oh, thank you so much, Britt, again. I really appreciate talking with you.
All right, everybody, until next time, this is the Brush with Brit podcast.